From the News Channel 5 Network, this is Inside Politics.
Hello, everyone. I'm News Channel 5's political analyst, Pat Nolan. Welcome to Inside Politics. The fight against the COVID-19 pandemic virus continues to be an increasingly difficult one around the world, across the country, and of course here in Tennessee and in Nashville. Multiple times in recent days, both the city and state have announced record numbers of new cases, while those hospitalized also continue to go to record levels. Even when new case records are not being recorded, the 14-day average on cases also continues to rise. To discuss where Nashville is and where we're headed in fighting the pandemic, along with several other major issues he's dealing with, we welcome back to the program Mayor John Cooper of Nashville. Mayor Cooper, welcome. Thank you again for joining us on the program.
Well, thank you, Pat. It's always a treat to be with you and here on Inside Politics.
This week, the director of the National Center for Disease Control and Prevention said if we had a national mandate for wearing masks, within 4 to 8 weeks, we'd see the virus beaten back. We've had one in Nashville for about over 2 weeks now, but we haven't seen much change in the numbers. Is the mask mandate not working yet in Nashville?
Well, welcome to America's challenge. Without a national response to a pandemic, it is hard for local areas to, I think, show progress. So that's both within our economic region in Tennessee and then within the country. Without a national mandate, you do have, I think, 42 states. I mean, Nashville is wrapped up in a national wave here of 42 states that are at all-time records, and then our own region. So you do what you need to do to keep your county safe, but a county response is not going to be that effective for us, frankly, nationally. You
mentioned in your briefing this week that there apparently are people in Nashville going outside the county to large gatherings, more than 1,000 people. You didn't say what that was. Is that delayed graduations from high school? Are those large church services? And what can be done about that other than urging Nashvillians not to go outside the county? And can the state help you about that?
Well, I think the state needs to help us about that. I mean, I've obviously been encouraging the state to have a deeper response than the every county for itself response. Obviously, those 1,000-person gatherings were not happening here in Nashville. We look forward to the time when they can happen here in Nashville, but they're not happening here in Nashville. And it's this, the disease experts call it the super spreader events, where a lot of people come in contact with an infected person, and everybody then gets the blowback from that. But that's one of the reasons that responding to the disease is so hard. We have to work together.
Can you name what those events are?
Bad actor can undo months of work. Sorry, Pat.
Can you name what those events are so people will know what's going on?
Well, there's that famous incident of the concert in East Tennessee. I've not gone through that event with the contact tracers, but it tends not to be religious church gatherings. There are no rules allowed in Tennessee on church gatherings anyway, but I'm happy to report that most churches have done a super good job. So I wouldn't tell people not to go to church on this basis, but when you do go to church, don't share your air. Churches have figured out how to do it, I think, often in a very reasonable manner, which is don't sit next to each other, don't share your pew, stay within your family, within your social group, come in separately, leave separately. All these things are just what we have to do in the current era.
You've asked the governor to do a statewide mandate. He says that's one size fits all. He doesn't want to do that. You've offered an alternative, which is right now the state cuts off nursing home visitation if a county is above a certain level. About 2/3 of the county now are above that level. Have you talked to the governor about your compromise idea, and what has he said?
Well, I'll try to be in touch with him this afternoon. Also, the White House issued a document about Tennessee that said basically the same thing, which is look at your hot spots and have rules for your hotspot counties that may be different than your other counties. Well, we now have a lot of hotspot counties. And Nashville is in the middle of a nest of hotspot counties. Some of the hotspot counties have responded, and in some cases responded as strongly as we have in trying to get the disease under control. And then I think last night it was reported the Williamson County hospitals are stopping elective surgery.
Do you
Right.
believe we're
Now-
getting close to that in Nashville? Is that going to happen? Because we have a lot more people coming in to be getting medical
Well-
treatment than just Davidson County people.
Well, not immediately, but it has to be under consideration. And that's why slowing the spread of the disease, particularly in hotspot counties, as per the White House guidance, would seem a completely appropriate thing to do.
If Governor
It is
Lee,
not
excuse me, go ahead.
a one size fits all. It is address the big problem right in front of you.
If Governor Lee doesn't institute some kind of mask mandate, even on an expanded level as we've been talking about, and you see the other states around us also putting in mask mandates, is he sort of having a failure of leadership on this particular matter?
Well, 26 other states have mask mandates. Even the White House feels that Tennessee and its hotspots will have mask mandates. I feel confident that the governor is going to protect public health in Tennessee and evolve us to a point where we are responsive to the crisis at hand. And when counties like Williamson are saying we're stopping elective surgery, this is indicating to everybody there is the possibility of a crisis at hand.
You said that wearing masks is the best way to keep us from having to go back to a complete shutdown. You cited a survey or a study that was done in your last briefing that if we could reach an 80% level of participation, that we drive the virus right down. Are we not anywhere close to 80% at this point? So far, enforcement has been mostly warnings, no citations. Are we going to get to 80% if we don't do citations?
Well, I think we're getting very close to 80%. I mean, 80% of anything is a big number in America and relatively hard to do. I think people naturally on their own, I feel, are getting basically to 80%. But having consistency and supporting the people who are wearing masks by telling the people who aren't officially that they need to be wearing masks is an appropriate thing to do. And it is true, places that have gotten to 80% and wearing masks have much better disease outcomes. Not immediately, but it takes some weeks to slow the spread of the disease to do it. And this is one of the few tools you have prior to having a vaccine. I mean, you can have shutdown and you can have vaccine, and in the middle you can have masks, but you have to have mask compliance to make it effective. A few bad actors can undo months of work by everybody, and it's unfair to the people who are doing the right thing and keeping themselves and their families safe if you don't point out to the people who are needlessly endangering the public health by being a disease denier, by pretending that we're not in the time of COVID and that they don't have to do anything to keep us all safe.
Mary John Cooper is our guest on Inside Politics. Back to continue our conversation with him after this break.